In the layman term, we can say it's a child under 1 month of age, but scientifically, while describing it are for the research and the other purposes, the neonate is a child under 28 days of age. Then come the infant, is a child till 1 year of age. Infant means all children till 1 year of age. It means newborn and neonate are sub part of the infant. Every newborn and neonate is included in the infant. During the first 20 days of life, the child is at highest risk of the dying. That's why it is crucial that the appropriate feeding and care are provided during this period, both to improve the child's chances of survival and to lay the foundation of a healthy life. The damage, the insult to the brain and the other parts which occur during the neonatal and the neonatal period may have effect on the lifelong of the baby, not quality, quantity, or the quality of life. Means the newborn baby, the neonate baby, if suffer from the disease, it will be very harmful to the baby and may cause the death of the baby. For example, the simple things which for an adult mean nothing, like the fever, etc. It means a lot for a newborn baby. This is the most important alarming sign of illness if the child is not feeding well, if the child is having fever. For the adult, we take a tablet of Panadol if there is a fever, but the newborn baby is having a fever, then need to investigate and treat it accordingly. Otherwise, may develop neonatal sepsis and chances of death are there. Now, coming to the objectives of the early neonatal care. Early neonatal care, when a baby is born, is the establishment and the maintenance of the cardiorespiratory function. When a baby is born, in fact, the fetus is a fetus now before birth, and after birth is a baby. The fetus does all the things. The fetus heartbeat is there, fetal move, even the fetus, the baby, the fetus ingests the liquor and even passes the meconium. So all the functions there, one function is not there, that is the breathing. The fetus does not breathe. All the oxygen is provided to the fetus by the placenta from the mother. When a baby is born and the cord is cut, now that oxygen supply is stopped. That is a stimulus for the baby to start the breathing, and immediately the breathing starts. There is reversal of the some flow of the cardiac blood flow, and the baby is now at its own. The baby has to breathe to have oxygen and to supply to brain by its own. So the establishment and the maintenance of the cardiorespiratory function is the most important event which occurs at the time of the birth. Second important thing, when we are taking care of a baby, a newborn baby in labor room or in the delivery room or in the operation theater, that is a maintenance of the body temperature. When a baby is born, it comes from a very protected environment. Inside the uterus, the baby is not subject to cold or the hot. When a baby is out, the baby is wet. And all the three mechanisms of loss of heat are there. That is the conduction, evaporation are there. And the baby immediately starts losing its temperature. So the maintenance of the body temperature is a great task at the birth of the baby. That's why immediately after birth, the baby is tied and is wrapped in a dry sheet and put under the radiant warmer or near to some heat source. Third thing, which is the objective of the early neonatal care, is establishment of the satisfactory feeding regime. The main source of energy to the brain of the baby is the glucose. Baby has to take feed because it has to maintain the adequate glucose level, adequate glucose supply to the brain. So immediately after birth, there should be some planning to start the feeding regime. If the baby is well, immediately after birth, baby should be started on the breastfeeding. If the baby is sick, then some other form of the nutrition should be started, like the IV fluid, etc. If the premature baby has some problem. Number fourth objective of the early neonatal or the newborn care is early detection and treatment of the congenital and acquired disorders, and prevention of the infection. It means when a baby is born, after establishment of the cardiorespiratory function, when the baby starts crying, the colors becomes pink, is dried, his temperature is maintained, he's wrapped in a sheet, started feeding. Baby should be examined in detail soon after birth so as to detect any abnormality in the baby. There are certain abnormalities which are very important and should be detected at birth, like cleft palate. Baby cannot fit if there's cleft palate. Like the baby has imperforate anus, which should be detected immediately after birth as soon as the detailed examination is carried out. And there are other things on which the baby life depends. For example, if the baby heartbeat is tachycardic, baby is tachypneic, baby's respiratory rate is increased, or baby is unable to breathe properly, baby is grunting, or the baby is unable to feed, baby is slow. There are a lot of other congenital anomalies from the skull to feet. They should, some of them are very important, vital, some are of the different level, but baby should be examined at detail at birth, and any congenital anomalies, or if there is some other disorder which needs immediate attention, should be detected and addressed soon after birth. So we have learned that the objectives of the early neonatal or the newborn care is establishment and maintenance of the cardiorespiratory functions, maintenance of the body temperature, establishment of the satisfactory feeding regime, most likely the breastfeeding. Of if the baby is sick or there's some other problem, then alternatively parental feeding, early detection and the treatment of the congenital and acquired disorders and infection, and avoidance of the infection. Avoidance of infection in the newborn is very important because these newborn babies are very much prone to infection. So everything which is used for the newborn baby should be clean. Even when a doctor or the nurse is examining the baby, handling the baby, either it should wear the gloves or should wash the hands with the soap and apply the sanitizer while handling the baby. The neonatal care is an easy task. When a baby is born, it starts crying, mother starts feeding, and there is no problem. But there's a lot of problems associated with this. So it's a teamwork of the multiple disciplines. It's not just an MBBS doctor, male or female, delivering the baby and taking all the care. It needs a whole team most of the time, not all the time. The team of the neonatology, in fact, consists of multiple disciplines, headed by the obstetrician and the gynecologist, pediatrician, preventive medicine, social medicine, community health services, and nursing services. This is a teamwork of these things. I make you understand. A baby is delivered by the obstetrician, gynecology obstetrician, same thing. Then the baby is being handled, taken care by the pediatrics. Preventive medicine is very important. Preventive medicine include breastfeeding, immunization of the baby, health education of the baby, keeping the baby safe at proper temperature. That is social medicine, community health services. In many countries, there are the nurses who visit the newborn babies at home and educate the mother. Even in the UK, the nurses go home and educate the mother and sort out the problem. In our country, in the rural area, there is a program of the lady health workers. The females are trained to take care of the baby, and they go home to home and advise the mother how to take care of the newborn baby and prevent the infection and the other disorders. So the neonatology is not a single discipline, it's a complex, is a work of the function of the multiple disciplines. Immediate neonatal care. We have discussed part of it, but we'll go in detail of this. That is, wash the hand with soap and water before handling the baby. If you are attending a baby who is just born or is going to born, you will wash your hand with soap and water before handling the baby. That is the most important one. Otherwise, you will transmit infection to the newborn baby. Then cleaning the airway. When the baby is born, the baby is kept in a position, and if needed, gentle suction is done. Suction is not important all the time. It is required sometime. Then we have discussed maintenance of the body temperature. That is a very important thing. After delivery, the baby gets hypothermic very easily. And a baby who is cold and hypothermic is prone to a lot of problems, metabolic problem, hypoglycemia, slow in feeding, etc. So the baby should be immediately dried because the baby comes from the wet environment. And if you are taking a bath in a cold environment, you come out without cleaning yourself, drying yourself, you will get the cold. So the baby will get the cold, and you dry the baby, wrap the baby in the dry sheet, discard that sheet, that linen which you are using from the cleaning the baby, and then keep it under the some warmer or heat source or at a place that is not cold. And start, of course, breastfeeding. Then there is, you go to the labor room, handle a baby after delivery, clean the airway, maintain the body temperature. Then you have to do Apgar scoring. What is Apgar scoring? Apgar scoring is, in fact, a method of assessing the status of the newborn baby at 1 minute, which will tell you how much help the baby needs from you. We'll go in detail of the Apgar score in the next slide. Then Apgar score is conducted at 5 minutes, which shows the results of your care provided in these 4 minutes, how much the baby has improved. Then there is care of the cord, care of the skin. Baby's umbilical cord has to be cut, and then clamp is applied there. Then care of the skin, we'll discuss about this, and breastfeeding. These all steps are included in the immediate newborn care of the baby. So we come to the first part, resuscitation. Resuscitation is, in fact, providing help the baby to breathe. It becomes necessary if the natural breathing fails to establish within a minute. As soon as the baby is born, the cord is cut. The oxygen supply, by virtue of the blood from the mother, from the placenta to the baby, is stopped. Now, the baby has to breathe itself. The lungs are inflated. The lungs has to be inflated. And then once the lungs are inflated, oxygen gets there, the oxygen exchange occurs, and the baby gets supply of the oxygen. So it becomes necessary after the delivery. If baby has some problem in breathing, then the resuscitation is required. Resuscitation equipment includes mucus extractor or the suction apparatus and an AMBU bag. It also includes the endotracheal tube, airway, and oxygen supply. These are part of the resuscitation, basic resuscitation equipments. Apgar score includes 5 things, and it is done at the 1 minute and 2 minute. 1 minute and 5 minutes, sorry. So there are 5 things. You don't get confused with this. It's very simple. I make you understand in a minute. 5 things are assessed on a baby in the Apgar score. Again, we start as soon as the baby is born. The cord is clamped and the baby is put to the baby trolley or the resuscitation trolley or the cot, whatever place is placed there. Baby is dried. If there is need, the airways are clean or the suction is done. 1 minute has passed during this. Now at 1 minute, you will assess how good is the baby. You will assess by the 5 things. Number 1 is the heart rate. Number 2 is the respiratory efforts. Number 3 is the muscle tone. Number 4 is the reflexes, and number 5 is the color. It looks more things to assess, but when we are doing it again and again, it becomes very easy. So we first come to the heart rate. If the heart rate is absent, there is no heart rate, the score will be 0. And the heart rate is greater than 100, less than 100, the score will be 1. If the heart rate is above 100, the score will be 2. 2 is the right score. So again, heart rate, if the heart rate is good, baby is having heart rate 120, 130. It means the score is 2. If the heart is 60, 70, the score will be 1. If there is no heart rate, the score will be 0. Number 2 is the respiratory effort. Respiratory effort, if the baby has good cry, quack, quack, baby is doing like most of the babies do at birth, score will be 2. If there is grunting, slow breathing, like this sound, the score will be 1. And if there is no breathing effort, baby is lying limp, the score will be 0. Third thing is the muscle tone. If baby has active movement, like a crying baby, moving all the limbs, quack, quack, moving all the limbs, upper and both limbs, movement of all the body, the score will be 2. If the baby is lying, just moving little bit, flexion position of the limbs, the score will be 1. If baby is lying flaccid, limp, no movement, then the score will be 0. We have seen 3 things: heart rate, respiratory effort, muscle tone. Reflexes. When we handle the baby and, for example, do suction, if the baby crying, active movement, the reflexes are 2. If the baby has just grimace of the movement, then there will be, the score will be 1. If the baby has no reflex, when you suction the baby, handle the baby, baby does not do anything, does not do anything, the score will be 0. And the fifth thing is the color. If the baby is pink, the score will be 2. If the baby has extremities, means the feet and the hands are blue, other body is pink, the score will be 1. And either the baby is deeply blue or deeply paler, the score will be 0. So these 5 things are assessed. In fact, on these 5 things, the score is taken. So overall, the best score a baby can have 10. But practically, the best score a baby can have 9, because mild cyanosis, bluishness of the hands and the feet are normal, and the score of 9 out of 10 is taken as a best score. This exercise is done at 1 minute and then at 5 minutes. So at 1 minute, for example, if the score is between 7 and 10, it means there is no depression, the baby is okay, you just dry the baby, you examine the baby for any anomalies, you start the breastfeeding immediately, even in the labor room, but better it is started in the labor room. Then, if the score is between 4 and 7, it means there is mild depression, mild asphyxia is there. The baby needs help. It's another task, needs another lecture to describe what help is baby is required. Use stimulus, give the stimulus to the baby. Sometimes baby needs embu bagging, etc., etc. Then at 1 minute, the score is 0 to 3. It means the baby is suffering from the severe birth asphyxia. Baby needs expert hands for the resuscitation of the baby. Baby will need embu bagging, stimulus, drying, suction, sometime intubation and support. So this Apgar score is very important. Everywhere where a baby is born, this chart should be there. The person attending the baby should be well acquainted, well aware of this Apgar score, should apply this score, and according to the chart which is described here, the baby should receive help. If you do not provide help to the baby will suffer from the lack of oxygen. It is asphyxia. It will be converted to anoxia. There will be irreversible, permanent brain damage to the baby. This baby will not behave normally. Development and growth will not be normal, and the baby will be mentally retarded. Maybe cerebral palsy, physical retardation may also be there, because if any part of the brain is damaged, even a small point, it will have a lot of consequences. So Apgar scoring are the helping the baby at the birth is very important. This Apgar scoring is done at 1 minute, and then it is repeated at 5 minutes. The 5 minute score will tell what help you provided has an outcome. Because, for example, many babies are born with a score of 0 and 3, between 2, 3. But by the time you provide help, you resuscitate the baby, you do the embu bagging, sometimes you do the cardiac massage, and the baby gets better in the next 2, 3 minutes. Most of the babies are born in the range of the 6, 7. But by the simple measures of handling the baby, which we have describing in the last 3 slides, the baby do improve. Now to come to the care of the skin. This is not as such medically important, but always a concern with the doctors and the attendants. The first bath may be delayed for 12 to 24 hours to the cooling. It was a tradition. The baby was given bath in the lake, handed over the baby in the clean condition. The parents were happy, but it caused a lot of problem. It caused hypothermia and so many other things. So the first bath is not necessary to be given, but better it should be avoided for a day. It should be done on the next day. The baby should be dried and cleaned with the linen or the sheet. The baby should be bathed by the nursing staff. Use soap and water to remove the meconium and the blood clots. Oil massage is acceptable. No reason to rub the vernix of the baby's skin, as it protects against the infection. You will be having the chance to see the babies in the labor room when you will be posting in the gynae and the peds. The baby is having covered with a sticky white substance that is called vernix inside the uterus. And when the baby is born, there is no reason to rub it and remove it. It's a very protective. It prevents the hypothermia as well as prevents infection to the baby. So prevention of the hypothermia, we have been discussing again and again. Actually, this is a very serious problem which occurs in our hospitals, in the community. When the eyes are delivering the baby, even the hospital, the adequate care, adequate attention not given to this respect. There is a warm chain. Immediately after birth, remove the wet towel, quickly dry it with a clean dry cloth, wrapped in a warm cloth, and give to mother for the skin-to-skin contact. When a baby is born, you take the baby in a sheet, not it's called a wet towel. You dry the baby and wrap the baby in another sheet and give to mother to the breastfeeding. This is called the warm chain. When the mother puts the dry baby on its skin, on the chest and the abdomen, mother is warm and baby is taken care from the cold stress, that is a hypothermia. Normal temperature of the baby is maintained around 36.9. That's 37 is a normal temperature. Examination then, after taking care of the hypothermia and starting the feeding, you have to examine the baby's congenital anomalies. Are the other conditions which are important, needs urgent medical attention, like peripheral sinuses, that is the bluishness of the hands and the feet, is a normal finding, is no problem, is no disease. That is why the F-bar at birth is maximum 9, not 10. But if there is sinuses of the lips and the skin, that is important. It's called the center sinus. That is not normal. That is a medical emergency. Imperforate anus, any difficulty in breathing, esophageal atresia, congenital heart anomalies, they must be examined after birth. In fact, baby should be examined from head to toe after birth to find any congenital anomalies, and you can only detect the anomalies if you are aware of this. Just by looking at anything and find the abnormality is not possible. It is an old saying, then the minds only detect those things which the mind already know. You should know what you're looking for. If you're examining the mouth of the baby, you're looking for cleft palate, then you will find the cleft palate. If you're examining the genitalia and the anal region, then what you're looking for? If you're looking for, then only you can find. Just by looking there and don't know what you want to find, it's not possible. So again, we come here. Flowchart of optimum newborn care. This is at the delivery. So at the delivery, if the baby is born, baby starts crying, and we do the F-GARD scoring, it's more than 10. When we dry the baby, wrap the baby in the dry sheet, and hand over to the mother, start breastfeeding. We keep the baby with the mother, we examine the baby for the congenital anomalies, and we send home baby with the mother as soon as the mother is discharged after giving his basic vaccination, that is the BCG and the oral polio drop 0 dose. This is a routine which 95, 97, 98% of the babies usually is done with the babies which are normal. But if the high-risk infant is the newborn baby is premature, preterm, having some problems, they suffer some asphyxia at birth, they suffer some other problems at birth, it's called a high risk. High risk has two types: without complications, means the baby is borderline like 35-week gestation, and there is nothing, baby is 28-week gestation, is not breathing, that's with complication. So if we first come, high-risk infant without complication, temporary observation unit, recovery room for the high-risk infant, or some sort of the NICU where the baby is kept for certain things like the respiratory distress, where the baby is taking feed or not. If there is some low abgar of the baby and baby is required some help, begging, oxygen giving at the birth, then needs to be observed for a few hours. Baby, high-risk infant, newborn without complication, is kept in the temporary observation unit, recovery room for the high infants, and if the baby is well, feeding is started, and baby is sent home with the mother, as we are doing with the normal baby. But if the baby has complications, like the baby developed distress, baby is cyanosis at birth, baby has difficulty in breathing, then the special care nursery with a intensive care facilities are the place where the baby should be kept. These baby require a lot of things. A special procedure will need intravenous fluids, will need oxygen by the different methods, like the head box, like the mask, like the nasal pump, like the CPAP, may need ventilation. They may need the parenteral feeding. They may need the phototherapy, exchange transfusion. Lot of things are required for the babies who have some complication, but their ratio is less than 1%. Most of the newborns are normal, but their normality should be assessed, and if some help is required, should be done accordingly immediately. So now we move to the maybe now the other parts, other aspects we have discussed in detail, the newborn care at the delivery room, and later on how we should proceed with the babies. Birth weight. Birth weight is the simplest measure which is indicator of the fetal well-being. When a baby is born, everybody is curious what is the birth weight. Even the doctor is very curious about the birth weight, because birth weight is a deciding factor, in fact, about the chances of survival of the baby. In developed countries, the average weight of the baby is between 3 to 4.5 kg at birth. In developing countries, the average weight is between 2.5 to 3.5 kg at birth. In Pakistan, the average weight is 2.9 kg. So any baby who is below 2.5 is called the low birth weight. So 2.5 and above is quite okay. Then if the babies are born with a birth weight of 2.5 kg, they are called the low birth weight. And usually low birth weight baby is seen in the preterm babies and the small foot baby. The low birth weight, the weight below 2.5 kg, in two types of baby. One, the baby is born before time. If the baby is born at 28, 30 weeks, 34 weeks, the weight will be less. Second thing is the growth retardation inside the uterus. The baby is born at the right time, above 37 weeks or 40 weeks, but the weight is 2 kg. Sometimes there is placental insufficiency, congenital anomalies in the baby, or the other factors in the mother like the hypertension, other toxemias, which prevents baby fetus to grow at its normal rate and results in the intrauterine growth retardation or the small for dead babies. Preterm babies, this is terminology of low birth weight is based just on the weight. The main terminology which is used is term. Term is 37 to 40 weeks of gestation. Babies who are born before 37 weeks are called the preterm. Babies who are born after the 42 weeks are called the post-term. Babies who are born between 37 and 42 weeks are called term babies. Now, there is a chart showing at which age what should be the weight of the baby. For example, if baby is born at 30 weeks, if the chart shown that the baby has a weight according to that gestation, it will call the appropriate for gestation age. If the weight is less than that, it will call small for gestational age. If the weight is higher than that, it will call the large for gestational age. So the weight of the baby depends on the gestational age of the baby. 34, 37, 38 weeks, the baby will have different weights and will be labeled according to that. So appropriate for the gestational, there is one terminology of the low birth weight. Second terminology is the term, preterm, postterm, and term. Third terminology is appropriate for the gestational age, small for gestational age, and large for gestational age. Appropriate for gestational age, for a given gestational age, the weight is between the 10th and 19th centile. That's okay. Small for gestational age is below 10th centile. Large for gestational age, above 19th centile. Baby will be classified, number one, as term, what term baby is had. Secondly, what is the gestational age and the weight? That is a baby will be like term AGA, term SGA, term LGA, anything, one of these things will be having baby out of this. Prevention of low birth babies. We will be discussing in detail in a lecture, that is the MNCH indicator, the infant mortality rate, the neonatal mortality rate. But here we discuss low birth weight babies. Low birth weight babies are the major contributor of the neonatal deaths. They are delivered. If the weight is low, many of them die within first few days, first month, first year of life. So one of the most important target is to prevent the incidence of low birth weight babies. If the baby is born with the right age, right time, and the right weight, the chances of survival will be much. So the incidence of low birth weight is reduced by taking the following measures. Nutrition of the mother looked after properly. The most important factor on the affecting the birth weight of the baby is the nutritional status of the mother. Mother should be provided adequate nutrition during the pregnancy. She has to bear her own metabolism. Secondly, she has to nourish a fetus who is growing inside her. She should be given, the pregnant mother should be given extra nutrition. In our country, no such care is given to the pregnant mother. She is doing the routine work of the home and she is taking the routine diet what other members are taking. It's wrong. Mother should be given extra food. High-risk mother are identified and then cared accordingly. High-risk mother means mothers who are in a certain category we will be discussing in detail as we move forward, who are lesser age, higher age, who are diabetic, who have blood pressure, who have jaundice, etc. Birth spacing. There should be a minimal interval of 2 years between the two pregnancies. If the pregnancies are very close, the baby is 6 months old, mother is coming with the next pregnancy, it will affect the birth weight of the baby of the next baby. Proper antenatal monitoring, 4 things. These the major we are discussing to prevent the low birth weight babies. So it's Arzu Nadeem. Arzu Nadeem, you are trying to enter the class at this time of the 9:30, whatever it is, not 9:30, it should be 9:40 like something. 9:44, that is not right. So, okay, proper antenatal monitoring should be there. These were the 4 measures which should be done to prevent the low birth babies. Then come the immediate management of the congenital infection. In fact, it is not the management, it is the prevention of the congenital infection. Neonatal tetanus, vaccination of pregnant women. Every mother should begin 5 days of that tetanus toxoid, which we will discuss in detail in the lecture of the vaccination. Deliver the baby in the clean environment and sterile cutting the cord. That is very important to prevent the neonatal infection. Hepatitis B positive mother. If the baby is born to the mother who is hepatitis B, there are 99% chances that the baby will get the hepatitis B infection and the chances of dying in the next few years will be much more. So if the mother has hepatitis B, the baby should be given prophylaxis within 12 hours of the birth. It consists of specific anti-hepatitis B immunoglobulin and the same time start immunization of the baby with the hepatitis B. Hepatitis HIV positive mother. No prevention is as such available for the newborn. And 4th thing is a congenital rubella syndrome. Congenital rubella syndrome is in fact a condition in which the mother gets the rubella infection during the first trimester. And it causes lot of deformities in the baby. Heart deformity, eye deformity, skull deformity, thrombocytopenia, lot of things, miserable life of the baby. So the mother should receive MMR or the rubella. MMR contains the rubella vaccination. Prior to be pregnant, before pregnancy, they should receive the vaccination of the rubella to prevent this congenital rubella syndrome. Infant feeding, in fact, we will having a whole class on the breastfeeding, but just we conclude here that under any circumstances, breast milk is the ideal food for the infant, and it should be started immediately after birth as soon as possible. If the baby has certain problem, then there are indications for the artificial breastfeeding other than breastfeeding, which are the engorgement of breast. That's a temporary indication. Then the severe septicemia in the mother, if the mother is HIV positive, if the mother is on treatment of the some oncology problem. Otherwise, breastfeeding should be given to all the babies. Growth and development. These are two different things. Development means attainment of the skill and functions. Growth means refer to increase in the physical size of the baby. For example, how much the weight is improving of the child is a growth. The baby is born with a 3 kg weight. At 5 months, the baby's weight doubles, and 1 year, the triples. This is a growth. The head size increases, the muscle power increases, babies. Other thing is a development. Development means attainment of the skill and the function. Speech, hearing, neck holding, walking, talking, all things are development, and increase in the weight is a growth. Milestones are the definite landmarks in the growth and development of child. They are attained in terms of the new skill and includes mental, social, and physical development. The important milestones are that at 3 months, baby start holding neck, and baby starts sitting without support at 6 to 8 months. Baby starts walking around 1 year onward. Some baby takes longer time. Heredity and environment are the two chief factors involved in the growth and development. To this added effect of nutritional disease. It means for the good growth and development, increase in the weight of the baby, increase in the mental development of baby, the progress depends on the heredity factors, environmental factors, nutrition factor, and disease also affect. The baby is sick, the growth and development will be not much. If the baby is being nourished in a healthy environment, the parents are very concerned, they do take care of the baby, provide adequate nutrition to the baby, that is a breastfeeding, then weaning at 6 months, etc., give proper immunization. The chances of milestones, better growth and development are very much that if the baby is ignored, not taken care of by the nutrition or the disease sector, then the baby will not grow at the normal rates. Growth and development do not proceed at constant rate. It is the most rapid in the first year of the life. As we have discussed, the child doubled its weight by the 5 months and tripled by the end of first year and quadrupled by the end of the second year. After 2 years, increase in the birth weight is steadily till adolescence. In fact, just 2 kg per year is increased after the second year of the life, while during the first year, the weight is tripled. And by reaching the third year, it becomes a second year, it is a 4 times the birth weight. But after that, the growth becomes a bit slow. There is a growth chart, in fact. You will be seeing it in the pediatric ward in the OPD. On the x-axis, the child age is plotted in the month. In the y-axis, the weight is plotted. And periodic weighing is done, and the curve is obtained, which indicates the child health. This curve is very important to see whether the baby is growing normally or not. For the purpose of comparison, growth charts are provided with reference curves. These curves show the limits of the normal growth. Look at this. These 2 lines are the upper and lower limits. If the baby's growth is following this curve, it means the baby is growing normal. If below the lower line, it means his health is deteriorating and needs some immediate attention. If it is above the line, it means also there is concern the baby should not become obese. The growth chart also has a space for recording immunization status. Name of the baby, identification registration is there, birth date is and weight is mentioned there. Mother's tetanus immunization status is also, and the child health record is also there. It's a record of showing the baby suffered from any disease and what happened to the weight of the baby. Growth chart is only effective when the mother is involved in all the activities. When a baby comes to visit you in the OPD, you examine the baby, you weigh the baby, plot it in the chart, and also show the mother. Your baby is growing well or going not. Because if the mother is not involved, then it's of no use for the baby. It's just for your research purpose. Growth chart is very inexpensive way of growth monitoring. On the growth chart, the method of preparation of ORS is also mentioned. So mother can read from it. So growth chart is a very good document for the baby, showing all the health record of the baby. Look at this. This baby was growing well. Here the growth decreased due to some diarrhea or the respiratory illness. Then counseling was done. Again, baby starts increasing the weight. Otherwise, mother and doctor would not have known the baby is having the problem if the weight is not plotted on the growth chart regularly. So use of growth chart we have discussed in detail. So we move to the next slide. This we have discussed from 1 to 4 all we have discussed here. So alternative methods of growth monitoring. The growth monitoring is one method is that the growth chart. Other method is height for the age. What is the height of the baby and what is the age? It can be charted there. Weight for the height. Weight and height are plotted, and whether this weight and height are accordingly. Then mid-arm circumference. Mid-arm circumference is very important indicator, show the nutritional status of the mother in a large place where the time is less and there is no weighing machine in the chart. Just take a mid-arm circumference, measuring tape, and measure the mid-arm circumference. These last two, that is the weight and height and the arm circumference, are independent of age and are very helpful if the age is not known. Stunting. This term is very frequently used. Even our Prime Minister in his speeches is telling that the most of the population, child population, is stunting. Stunting reflects chronic malnutrition, inadequate length at the height relative to age. It shows the chronic malnutrition and it has a very bad effect on the growth and the mental development of the child. So the stunting means chronic malnutrition. If the malnutrition stays for a long time, the height and the weight of the baby will be less than the normal. There is underweight. Underweight reflects both the chronic and the acute malnutrition. Inadequate weight relative to age is called the underweight. More than 50% of the population of Pakistan is underweight, and around 30% plus population of the Pakistan is stunted, child population. The usual causes of the maternal morbidity should be prevented by the proper antenatal services. We have discussed these things in detail, but the problems, a lot of problems are there and they can easily be prevented by the good antenatal care services, and they are of great help to the, even not to the mother, to the health of the children also. For example, if the mother's blood pressure, hypertension, diabetes, other congenital infection, other infection of the mother like the torch infection, syphilis, etc., are taken care. So the mother should come to the antenatal clinic. Minimum number of visits in the first year of life. Minimum number of visits, that's a baby, should come after birth to the doctor. Visit in the first year of life once in every month. First, the mother should be taken care during the antenatal care. Then the baby should be delivered properly and started breastfeeding, immunization, and then baby should come to the health center once a month for the first year, and after 1 to 5 years, once in 3 months. That's why the doctor or the healthcare provider will know whether a baby is growing well or not, is there any problem. So for this, there is under 5 clinic. Under 5 clinic take care of the babies from birth to 5 years of age, and it has 3 functions: growth monitoring, preventive care, that is the vaccination and the other nutritional advices, and care in the illness. The baby may have some problem like the pneumonia, diarrhea, cough, etc., that will be taken care of the under 5 clinic. So there is a relative neglect of child of the preschool age. They need attention. Babies before going to school, in the school teacher can assess the baby has a problem, but at home, if you do not visit any hospital with a new baby of 1 year, 2 years, no one will knowing whether baby's growth is good or not, development and the other skills also. So they need attention. Large numbers of baby are there. This is the age where the mortality and morbidity is very high. This is the age 1 year, 2 year, 3-year-old children suffer from the pneumonia, suffer from the diarrhea. So this age is very crucial, and under 5 clinic should be there, because babies after 5 years go to school, they can be screened to the under 5 clinic. This is a chart showing the different causes of death. And if we have a look at that, diarrhea, pneumonia, measles, malaria, injuries. These are the leading causes of the death in the newborn baby. The prematurity, neonatal tetanus, neonatal sepsis are the leading cause of death. So these causes of death should be prevented, should be tried to prevent. So Under 5 clinic is a function within the aim of providing curative, preventive, and promote health service in children. Care of illness means if the baby has certain problem, that care should be provided. The care which a baby needs from in Under 5 clinic is the immunization, growth monitoring, regular health check, oral hydration, and at the same time, mother, while taking care of children, mother should be advised about the family planning and the birth spacing. It will be very helpful for the family. Causes of growth failure. In Pakistan, as we have discussed, the 50% children below 55 years of age, 50% children are malnourished, 30% are stunted. The causes of growth failure are failure of breastfeeding. We do not breastfeed the baby. We'll discuss in detail in the breastfeeding section. Inadequate nutrition. At 6 months, baby should be started with the weaning diet, complementary feeding. That is not started most of the time. Baby keep on breastfeeding till 1 year, 2 years. Intestinal parasite. The worms are there in the intestine of children and they suck the blood in the nutrition. And an infection. There are many infections in the baby having diarrhea, pneumonia, and results in the growth failure of the baby. The organizational structure of the MCH is 1 doctor for greater than 20,000 population. Lady health visitor should be there for the 3,000 to 5,000 population. 1 trained dia midwife should be for 100 births and trained 1 birth attendant for 1 village. This is the minimum requirement for the human beings. There should be a lady to help the mother to deliver in every village. There should be a lady health visitor for every 3,000 to 5,000 population, and there should be a doctor on 20,000 population. This is a chart showing the mortality in around the infancy. We will discuss in detail in the MCH indicator. Just have a look at that, the different types of the death. If the baby dies before 1 year of age, it is called the infant death, is infant mortality. If the baby dies within 28 days, it is called neonatal mortality. And if we take the we add the stillbirth, that is the intrauterine death plus the death within the 1 week of the death. That is an early neonatal death. This is called the perinatal death. We will discuss perinatal death, neonatal death, infant mortality in the section in our lecture on the MCH indicator. This is just an appetizer for that. So with this, I conclude my lecture. I hope I'm successful in communicating you the importance of the infant care, newborn care, infant care, and the child care. This is very crucial. We start the we take the proper foundation of the health of the child. If the baby is taken care at during the pregnancy, at the birth, and later on till 5 years of age, the chances of survival and the quality of life of this child will be beneficial for himself, for his family, and to his nation also. Thank you very much. I conclude my lecture here. Thank you, students.
Thank you, sir. Thank you.
Thank you, doctor. Okay.
Thank you, sir.
I think